We are now talking about series of medical ethics like consequentialism and deontology and other uh, fields. We are trying to learn what is accepted in medical ethics, how we should behave in different medical situations, and I told you before that we have different culture, different standards of ethics, and we are trying to improve the medical practice and research through commitment to professional ethics. The aim of ethical theory is to provide a method to help doctors to answer the question of how we should behave in different medical situations and to outline some of the most known theories in the field. The first theory is moral objectivism. What is you are doing will depend upon facts, not about persons or culture. So you are stick to the situation, what you have in the situation. It is one of the accepted theories. In this moral relativism, what is morally right or wrong will depend upon the view of the society, the culture. For example, you can tell a child that take this sweet and it is not a sweet, it is a medication. You can lie on children and this is accepted. So there will be a debate upon this theory because your ethical values and principles will be variable according to the person you see, according to the prevalence of certain ideas in your uh, society, like lying on children, as I told you, like battering females, some father you may found him broken the arm of a child because he is trying to correcting him or learning him some disciplines, and this is accepted in your society. In some tribes, they can kill the elderly because they are of no beneficial to these tribes. This purely not ethical, but it occurs in our society and in different societies. The third theory is what we call a consequentialism. Your action will depend upon the consequence. So you don't behave properly except if you waiting for something good. Like what kind of consequence? One way to divide various consequentialism is by the types of consequences that are taken to matter most. What is the most important at the end of the subject is to take something good or consequence to certain person. You are concerned about that person. You will be good to your boss, not to other person. If you find that the child of your senior or your manager, okay, is ill, you will behave good with him, not because you must behave good, but you are waiting for something good from your superior or from your senior. Sometimes there is consequentialism according to action guidance. Uh, it is the ability to produce practical moral judgment. Okay, a better theory that has been used specifically in the ethics committees is what we called a utilitarianism. It is an ethical theory that states that the best action is the one that maximizes the utility. Another theory is called deontology. It is when you behave ethically, it will depend upon what is right and what is wrong, and what is your motivation, whatever the consequence will be. So you are not waiting for a reward. You are not waiting for that your patient will be cured. For example, some people, we can see some doctors or some hospitals, they will never taking the patient when the outcome and the prognosis of that patient is bad. Okay, because this will affect its reputation, this will increase her mortality or his mortality and morbidity rate. Okay, so they won't treat that patient. So in deontology, it is focusing upon what is right or wrong according to the intentions, motives behind that action, like respecting the rights, duties, principles, whatever the net results will be. It argues that there are 7 right-making features of the moral action. There is duty of beneficence, a duty to help other people; duty of non-maleficence, it's duty to avoid harming any people; duty of justice, be fair to all people and they should get what they deserve; duty of self-improvement, to improve yourself as a doctor; duty of reparation, it is a duty to recompense someone if you have acted wrongly toward them, go and apologize, make a compensation to that person; and duty of gratitude, where a duty to benefit the people who have benefited us. There is a mutual benefit between two people. Someone help you and I will help back. And duty of promise keeping. It is a duty to act according to the explicit and implicit promises, including the implicit promise to tell the truth. Some people not accepting deontology theories and say, what if you doing your duty will result in bad consequence or bad outcome? Also, that this duty-based theory doesn't deal well with all cases, especially if there is conflict. It settles absolute rules. They have no error, no accepting to the error of human being. This will make the world less happy. As regard the consequentialism, uh, which will depends, your act will depend upon the consequence or the outcome. Okay, they said that it is impractical to real life, and it is sometimes harmful or bad to the society. Uh, Another theory is called a principilism. It attempts to have it both ways. Okay, it is now the dominant theory in medical ethics. It depends upon the principles of ethics, like autonomy, beneficence, non-maleficence, and justice. Autonomy means a competent patient can choose actions which is inconsistent with their values, goals, plan of life, even if this decision will be against the medical advice and against their family interests. Regarding beneficence, it means act to the best interest of your patient, non-maleficence, don't do harm to your patient, and justice means it will be fair, you will be fair to all of your patients without differentiation. And here is some question just for you to answer.